And it takes me to section number 4, which is called as culture. Now, culture is all about, as we say in the UK, training practices. If I'm a training practice, if I'm a supportive practice, if I'm here to help with induction, training, capability assessments, audits, retraining, reinduction, my team is going to be very well engaged. My team is going to be very well fulfilled. My team is going to be feeling really reassured that I know exactly what I'm doing. And there are 3 very important sections in DenTTrack. Number 1, resources. In resource section, it's not just about CQC, but I'll show you the CQC section. Let's take audits. So as a folder, subfolder section, CQC audits, everything is here. I want to see risk assessment, everything is here. I want to see, okay, let's look at gap analysis, very important feature. There's something called a CQC gap analysis I would like to show. You are a practice who is struggling with CQC. You just pull up our CQC analysis spreadsheet, sit with your team manager and say, listen, do we have an audit for disability access? And the manager says, yes, we will do it. So we'll say dental practice will do it. You say, what's the status? It's in progress. It will mark it as orange. Okay, Nikki, is the audit for infection control there? No, we need to get an external supplier to actually do this for us. And at the moment, I'm going to mark it as no. So that will flag as red. So all these 300 items here, you can go one by one to do a quick gap analysis, find out, is it me as the owner who's going to do it? Is it the dental practice team members going to do it? Is it external supplier who's going to do it? Or do I want to contract DenTTrack and DenTTrack can come and do it as well? So we provide human resource for you to finish the stuff as well. So you can always say no. And sometimes you say actually dental practice and we have done it, and you'll say yes, and it will become a green. So you know exactly what you have with this gap analysis, and that's a resource you have inbuilt in here. So going back to support, Chris Barrow, all his intellectual property around managing a dental practice, growing a dental practice, right from spreadsheets up to marketing, everything is in here. DenTTrack has created a section called as marketing. You want email marketing, patient education, SMS marketing. You can click here and lots of emails have been written down for you to send across to your patients. SMSs have been written to send across to your patients. Patient education templates, consents, everything is sitting in here. You have standard operating procedures for various categories of how to do it. Basically, they are sitting in here. And most importantly, just connecting straight into resources into this button called as training, a completely new portal opens up, which is 200 plus CPDs, where anything and everything in the standard operating procedure is being done as a video for you. So if your team member is struggling to say, listen, I want some training on safeguarding children. I want a quick induction on CCTV testing. I want an induction on CCTV functionality. I want something on appointment book management. So you name a topic and you will find it in this section. So going back into DenTTrack, you will have lots of resources, and there's a treatment coordinator section, which is fabulous with consents, with scripts or how to speak on phone. Quite a few things are in here. Now, if you say, listen, my telephone receptionist needs to know how to speak on phone, just put a word telephone. Okay, nothing comes up. If I go receptionist, sorry, 1 second. As soon as you put the word receptionist training guide, and if I go into this one, this is DBM and Chris Barrow document where all the scripts are how to speak to new patients, how to speak to emergencies, implant inquiry, Invisalign inquiry, whitening inquiry, everything is written in here. I'll show you one more, which is my favorite. response directory. And let's see if that comes up. Yes, inquiries response directory. And that's a beautiful resource to say by Chris Barrow to say, if there are questions asked by patients, what's the primary answer you give? What is the conversation question you ask? And what are the secondary answers for that as well? So there is a communication toolkit here for your receptionist treatment coordinators sitting in here, which gives you ample resources. So for some people who are asking us, is this a CQC software? And I'm saying, yes, that's a small part of this software, but you can actually run your dental practice on autopilot, and there are more than 1,200 resources sitting in here. So other than resources, training is something which I have just shown you, which is all the videos, and your team members actually can get their CPD certificate. So you don't need to go for verifiable CPD for your dentist or your dental nurses anywhere. You can easily pick up 15 hours of CPD or more for GDC registered people. So that's in there as well. Another last section in fourth bucket called as culture is help material. So this is like Netflix, and we say, I want to see all the training for dental nurse. I put the word dental nurse, and anything and everything around the jobs and the help material around the jobs, everything is sitting in here. So practice premises opening SOP followed. There are various documents which are here. Preparing daily PPE. There is a video here. So if you recruit a dental nurse, even before the recruitment now, we give them the DenTTrack portal. We give them the section to study and come in for the interview, which means our interviews are more robust, and we select a candidate who has made efforts, who is learning through the portal. And I think Serena is here. She gave us the idea to say, can we recruit based on DenTTrack portal? And I said, that's a fantastic idea because we can recruit. And once they are recruited, they're already understanding how to do things based on our blueprint, which is our clinical blueprint. And on that note, I'm going to show you what a blueprint means. So these videos are something which are given by DenTTrack. But if I get here, and I'm just going to see if I can get in as Paula. Okay, I might get in as Deepa. Let me see if I can find it in Whitchurch. So if I go in the user section, can you see this one? Manage help material. And can you see? There are 19 videos the team has done. So I'm going to probably click on switch on compressor.
Set up a surgery, you need to turn the compressor on. So the compressor is...
So the volume is a bit weak here. I can hear it. I don't know if you can, but you can make this 30-second videos to say which button to open, where to click for the compressor, which button to click, which knob to move, where is the wiring, etc., etc. And anybody starting in our Whitchurch practice, they don't really need to have a handhold induction. They can actually go and say, how do we check oxygen levels?
When a medical emergency occurs in a practice, the most significant things for a team and for us to do is to provide oxygen to the patients every day. The other one is in upstairs in the OPG room. So this is how the settings look like.
So for me, the beauty is the practice is now running on autopilot. In a sense, my team members have already recorded how they do things, which means a team member leaves and they have moved away for family reasons, etc. You're not really stuck because what they were knowing is already blueprinted in my system here, and any newcomer can now be shown. So even if I'm away for 2 weeks and things go wrong, not things go wrong, but things need to be understood, then possibly it's already in a blueprint in my portal here. Practice owners also remember when you are exiting, when you are selling your practice, if you go with a robust portal like this, investors will be more interested in you than the neighboring practice because you have systems, you have a portal, you have a team, you have everything done to the dot. So for a newcomer, they don't need to reinvent a wheel because DenTTrack is their go-to portal, basically. So that's section number 4 called as resources, help materials, and training.